Hello and welcome to the HemWell MD Sales Training Series. In this session, we will discuss how the HemWell procedure works and is performed. We will begin by discussing how the HemWell procedure works. The HemWell procedure is best described as direct current electrolytic ligation, which is monopolar direct current applied to the base of the hemorrhoid at 6 to 16 milliamps at a time. Unlike other treatments that cut out the vein, cauterize it, or scar it, the HemWell procedure is the only treatment that works with the body in a natural and non-invasive way. The proprietary action of the milliamperes current creates a unique biochemical reaction within the vascular feeding vessels at the intracellular level of water, which causes the release of hydrogen ions, and thus creating a foaming action concentrated at the point where the probe tip touches the base of the hemorrhoid, which is also known as hydroxylation. This foaming action is a visual indication that the process is working and is not critical to the destruction of the hemorrhoid. The critical reaction is the production of hydroxyl ions, or OH, which results in a strong basic environment around the probe that results in the denaturization of proteins, a thrombosis of the capillary feeding vessels, and a chemical ligation or cauterization within the vascular feeding vessels of the hemorrhoid. The result is a destruction of the hemorrhoid as the contents of the hemorrhoid are reabsorbed by the body. This release of pressure and shrinking of the tissue leads to immediate relief with the patients. In short, direct current is applied to the hemorrhoid base, causing a dissociation of salt water, which creates sodium hydroxide within the hemorrhoid, causing the vascular thrombosis and tissue volume loss, causing the hemorrhoid to shrink and be destroyed. Now we will discuss the pros and cons of direct current electrolytic ligation. Pros are, it is the least painful of all options. This treatment can be used on all sizes of hemorrhoids with no cutting, stabbing, or injecting. Anesthesia is not required. There is a very low reoccurrence rate. No prep is required or any risk for incontinence. Cons are it's slightly uncomfortable procedure, and large hemorrhoids such as grade 4s may require additional treatments. Let us now discuss some of the contraindications for the HemWell procedure. Because of liability issues with unborn children, we do not recommend nor do we endorse performing the HemWell procedure on someone who is pregnant. Keep in mind that a provider can be sued from the time a baby is born until the child is 18 years of age. There have been no studies on this issue, so we don't recommend performing the procedure on pregnant women. Secondly, anyone with a pacemaker or defibrillator implant, we recommend that the patient get clearance from his cardiologist before treatment begins. We do not recommend the HemWell procedure for anyone with a bleeding disorder. If a patient is on anticoagulant therapy such as Coumadin or warfarin sodium, we request that the patient get clearance from their cardiologist first before being treated with our procedure. Also, anyone with an active anorectal infection or inflammatory bowel disease are now not eligible for the HemWell procedure. Patients who have lower abdominal, lower quadrant transplant patients, such as patients who have had a hip replacement, should get clearance from their family physician before proceeding with the HemWell procedure. And anyone who has Crohn's disease. Now we will discuss performing the HemWell procedure. However, before we begin discussing the procedure, we need to discuss the importance of good documentation. It is critical that the provider document the issues that the patient is experiencing. For instance, protrusion, pressure, pain, discomfort between bowel movements, rectal bleeding, blood stain in the underwear, or any anal itching or burning. If this is not noted properly, then the insurance company has a reason to deny the claim due to not meeting medical necessity. For simplicity and accuracy in documentation, we have divided the anus up into 6 different anatomical positions. These anatomical positions are right or left and anterior or posterior positions. Following the completion of a colonoscopy, the patient will be in the left lateral position. Begin the procedure by placing the disposable adhesive grounding pad to the patient's right hip and connect the grounding cord. Assemble all the components of the HemWell machine, remove the anoscope from the packaging, and lubricate it liberally. If the patient has not had a colonoscopy, then perform a brief digital rectal exam. If the patient has had a colonoscopy, this step is unnecessary. Take the anoscope and insert it into the anus in a slow but deliberate motion with the slit in the 12 o'clock position. By doing this, will help the provider keep track of the position being examined. Be sure that you are inserting the anoscope, that you have a firm hold on the arbitrator, or it will become dislodged and potentially injure the patient. Inserting the anoscope can be performed with one hand or two. Once the anoscope is in the exam position, the provider will need to have one hand to hold the base of the anoscope in place, and the other to remove the arbitrator. With the other hand, the provider will remove the arbitrator in a slight twisting motion from the base of the anoscope. Doing this will keep from potentially injuring the patient. Note, the hand that is holding the base of the anoscope must maintain consistent pressure to keep it from being pushed out. Keep in mind that if the anal sphincter is working correctly, it will be trying to push the anoscope out of the body. Once the arbitrator has been removed, the provider will be able to visualize the hemorrhoid as it falls into the slit, noting the size and grade of the hemorrhoid. Record the findings. Once findings are noted and recorded, reinsert the arbitrator. Slowly pull back on the anoscope about 2 to 3 inches depending on the size of the patient, and turn the anoscope to the next position. Slowly and deliberately reinsert the anoscope. Keep pressure on the arbitrator as the provider inserts to ensure that it's not misplaced or potentially injures the patient. Continue these steps until all 6 anatomical areas have been visualized and recorded. Following the exam, the provider will likely choose the largest 1 or 2 hemorrhoids visually to treat. Now we will go on to the procedure. For training purposes, we will say that we have visualized the largest hemorrhoid in position 1, and we have properly inserted the anoscope and removed the arbitrator to visualize the hemorrhoid. Please keep in mind that the provider will need to hold the base of the anoscope during the treatment as well, so the anoscope is not displaced. The provider will take the control handle with the probe catheter attached and will slowly insert it into the probe into the anoscope, gently placing the tip of the catheter at the base of the hemorrhoid. The provider will slowly increase the voltage to 16 milliamps if the patient is sedated. If they are conscious, the provider will likely keep the voltage around 6 to 8 milliamps, and treatment time is around 5 minutes. It is important to note that the circuit is only complete when the probe tip is touching the patient. The control handle will not register any voltage being delivered if the probe tip is not touching the patient. The tissue around the treatment site, the provider will note a slight bubbling action, much like you see when you pour hydrogen peroxide on the skin. This is the hydroxide effect occurring. The provider will need to keep the probe catheter on the base of the hemorrhoid for the entire duration of treatment. Treatment is based on the size or grade of the hemorrhoid and the voltage guideline treatment times. Once treatment time has been completed, stop the voltage by pushing both the up and down buttons simultaneously. Note the probe catheter must be touching the hemorrhoid while doing this, or the voltage will pick up right where you left it off last. Upon pushing the up-down button simultaneously, the on light will go out. The milliamp bar at the top of the control handle will go out and the timer will stop. Once the voltage has stopped, the timer can be cleared by depressing the timer reset button. Record treatment time on the chart. The timer reset is not dependent upon the probe catheter touching the patient and can be performed anytime. Carefully remove the probe catheter from the inside of the anoscope and set the control handle aside. Clean off any fecal material or excess lubricant from the tip of the probe catheter with a 4x4. Insert the orbitreator back into the anoscope and make the decision of ending the treatment or moving on to the next hemorrhoid. Here's some final thoughts to remember about our procedure. Number 1, always wash hands before beginning the procedure or completing the procedure. Wear personal protective equipment such as face mask, eye protection, and gloves. Our stencil drawings in this presentation did not reflect that. Number 2, always have one hand holding the anoscope at all times. If the anal sphincter is working correctly, it will be pushing the anoscope out, and the anoscope could potentially injure the patient if not held firmly. Number 3, fecal material or KY lubricant will often end up at the tip of the probe catheters. This must be wiped off before moving on to the next hemorrhoid because these will interfere with the current being delivered. Number 4, hold the probe catheter in place until the voltage has completely stopped because the machine will pick up where the voltage was when it was removed from the hemorrhoid. Number 5, when treating, the probe catheter is placed at the base of the hemorrhoid. Take care that it does not penetrate the tissue in any way. And finally, if the patient starts to cough, remove the probe catheter until the patient stops coughing. Following the procedure, with the caveat that the patient wasn't sedated, for example for a colonoscopy, the patient may return to work and go back to the regular activities that same day. We ask the patients to wait 4 to 6 weeks between treatment. Many insurance companies require 6 weeks between, and some like Aetna and Medicare require 90 days. Now we will discuss potential complications. With the HemWell procedure, there is a very low level of issues regarding any complications. About 1% of individuals have a minor complaint. These are often reported as minor rectal pain, small amounts of rectal bleeding, and light serine sanguineous drainage. These issues usually resolve within 48 hours. We encourage patients to treat these symptoms with over-the-counter acetaminophen and over-the-counter Recticare topical cream. Of course, for legal reasons, HemWell MD and its other affiliates are not endorsing the use of this product. However, we have found them to be effective. So this concludes how the HemWell procedure works and is performed, and we thank you for your attention.